Are there legal options for medical gaslighting? Medical gaslighting is a term used to describe situations where healthcare professionals dismiss or minimize a patient's symptoms or concerns. This can be particularly harmful for individuals dealing with post-traumatic stress disorder or other trauma-related conditions. When patients feel their experiences are invalidated, it can worsen their symptoms and delay proper diagnosis and treatment. From a legal standpoint, medical gaslighting is not a specific legal claim. However, it can be part of broader legal actions if it results in harm to the patient. The main legal avenues available for patients who believe they have suffered due to medical gaslighting are related to medical malpractice or negligence. In some cases, it may also involve claims of intentional infliction of emotional distress. To successfully pursue a medical malpractice claim, certain elements must be established. First, there needs to be a doctor-patient relationship at the time of the incident. Second, the healthcare provider must have owed a duty of care to the patient. Third, the provider must have breached that duty, which could involve failing to take the patient's symptoms seriously or ignoring valid concerns. Fourth, this breach must have caused harm to the patient, such as a delayed diagnosis or worsened symptoms. Finally, the harm must be significant enough to warrant compensation, which could include medical expenses, lost wages, or pain and suffering. In cases involving PTSD, if medical gaslighting leads to a misdiagnosis or delayed treatment, it may be possible to pursue legal action. However, these cases can be complex and often requiring expert medical testimony to demonstrate that the provider's actions fell below the accepted standard of care and directly caused harm. Patients who feel they have been victims of medical gaslighting are encouraged to seek a second opinion from another healthcare provider, especially if they feel their concerns are not being taken seriously. Reporting the provider to their supervisor, clinic, or medical board is also an option. Legal action may be considered if the gaslighting resulted in measurable harm, but it is crucial to consult with an experienced attorney who specializes in medical malpractice to understand the specific requirements and deadlines in your area. From the perspective of PTSD, medical gaslighting can be particularly damaging. It may reinforce feelings of isolation and mistrust, which are already common among trauma survivors. Recognizing and addressing medical gaslighting is essential for recovery and ensuring that individuals receive the care and validation they need. In conclusion, while there is no specific legal claim for medical gaslighting, it can be addressed under medical malpractice or negligence laws if it results in harm. Patients should advocate for themselves, seek support, and consider legal consultation if they believe they have been harmed by such practices. Always consult a qualified healthcare professional for personalized medical advice and an attorney for legal guidance.